The Council on Health Research for Development, COHRED, launched its first ever Africa office named COHRED Africa on November 6, 2014. The auspicious event was held in Botswana's capital city of Gaborone at the Phakalane Golf Estate. COHRED Africa was initiated in 2012 and its offices will be hosted in Botswana, but will work as a networked organization throughout Africa. Over 50 participants from across the African continent and the globe graced this high-level event. Participants spanned from government dignitaries, funders, donors, regional political bodies, as well as the private sector. The opening ceremony provided the history of COHRED, its mandate, vision, and the global impact. Discussions also emphasized the timeliness of COHRED Africa.
COHRED began in 1993, so this is its 21st year of existence. The first part of its existence was really focused on the agenda of creating a necessity for what was called essential national health research. It's the countries themselves that need to make the investment in people. Research starts with people, but people have to work in an infrastructure, and so building the infrastructure. COHRED's experience in working with multiple countries to help each country develop its own research infrastructure, creating priorities and making the proper investments, and particularly in this decade when the resources from outside of the countries are not going to grow. If anything, they're going to shrink.
The COHRED Africa launch theme centered around supporting Africa's development through research and innovation for health.
From my side, as the head of COHRED Africa, I look forward to continued partnership and also looking forward to building further strategic partnerships that will assist us to get COHRED Africa to where we would want to see it.
I was also reminded this morning by another student, Dr. Modolo, who sits on that side, who says, well, you've been dreaming about getting COHRED Africa off the ground since ever you left, since we spoke about, which was 2001, 2002, 2003. So it's been a long time in coming, and so it's a particular pleasure to be at this occasion, to be able to speak a bit. If Africa is really rising now, then that rise should also be reflected in building its own infrastructure in terms of research and innovation. And I think it is patching up, it is getting in some places, if you look at the continent. So very much like the skyline of Africa in capitals around the continent has been changing over the last 20 years. So slowly there is an improvement in science and technology capability, interest, local funding, and you'll find that many of the speakers here this morning and throughout the day actually reflect on their experiences in funding science and technology. So I just wanted to give you two big reasons why you should invest in science and technology, and perhaps some ideas of where we can go.
A highlight of the COHRED Africa launch was the high-level CastNet Plus panel session. The CastNet Plus project was formulated and approved by the European Commission with a mandate to enhance the European Union and African Union bi-regional cooperation among actors working on three specific societal challenges, namely health, food security, and climate change, with the ultimate goal of strengthening research and innovation on all three of these areas. Within the context of building a sustainable research and innovation collaborative platform for health between the EU and AU, the aim of the panel discussion was to address the themes on funding processes and mechanisms in the African Union and explore and identify strategies for enhanced private sector engagement to support bi-regional cooperation for health. Other key highlights include the showcasing of current work of COHRED Africa, rhino ethics, fair research contracting, as well as the Fairness Index.
And one of the solutions that we came up with was the development and the implementation of what today is well known as Reno Ethics, which is basically an online platform which is intended to replace the current widely used complex paper-based system that we saw across African countries with an online platform. Reno is intended to speed up the ethics review of research protocols. We noted during the data collection in Africa that it takes on average at least 18 months to get ethics approval. If we translate that to practice, it actually means that there is actually an 18 months delay of getting essential medicines, diagnostics, and vaccines to people who need them on time. And we as COHRED, we are trying to bridge that gap. So far, we have been successful in terms of getting Reno platform implemented. We have countries, we have Swaziland on board, we have Mozambique, we have Tanzania. In Mozambique, we have the Portuguese version. We actually have the platform in different languages. So we have Mozambique, we have Tanzania, we have Malawi, we have Kenya, we have Senegal, and we have Nigeria.
COHRED partners with a lot of international organizations, governments, institutions, as well as civil society organizations.
The marriage between COHRED and EDCTP is based on what we at EDCTP call like-mindedness. So EDCTP is a partnership of European and developing countries formed in 2003 to respond to various calls to do something about the major poverty-related diseases over and above other initiatives like the Global Fund and others that we're already funding good practices.
Research for Health Africa is one of our initiatives. The project provides knowledge, advocacy, as well as technical support to various African countries as part of their own efforts to improve research for health. Its first phase was concluded during the COHRED Africa launch, and discussions on expansion into other African countries were discussed. COHRED Africa will focus on helping to create an environment in Africa in which research and innovation for health, equity, and development can flourish.
Thank you very much, first of all, for COHRED's invitation to this very auspicious occasion where we see the launch of COHRED Africa Charter. This is very significant for us as Swaziland because of the partnership that we already enjoy with COHRED.
I had a word from my Principal Secretary of the Ministry of Health and my Director General from the National Commission of Science and Technology that convey our gratitude as Malawi to COHRED Africa and tell them that to everything there is a season. And indeed, having COHRED Africa this time, Malawi says it's timely, it's not too late. Perhaps if we had done it that time, we may have missed certain opportunities. So today and this year, we are so blessed and it's so timely to launch this COHRED Africa.
It is very important that we recognize the regions and how do they keep their research institutions working as a team. Now we are suffering to respond to the disease of the day now. We started with it. So I think that it is a thing to be considered by COHRED Africa. Because if you can understand well, it is the only organization that presents herself in our continent to continue what they started at international level like WHO, where they were.
Now we need to stand for ourselves first, and hopefully, think about African grand challenges, which we could, all of us, have a kind of contribution in getting more and more contribution to research for health in Africa.
COHRED Africa launch marks a footprint of COHRED in Africa and has received very positive uptake from various African countries and partners.